Hi, I'm Ray Gillick. I'm a nurse for the Dublin Simon Community. I've been a nurse now for 39 years. 20 of those have been spent working in addiction medicine. I currently work in homeless services for Dublin Simon in their primary care, and before that I was working in their detox program. The supports that someone's going to need during an alcohol detox is not just the supports that the physician provides in terms of management of the medication, but it is an emotional roller coaster. There's the higher risk of symptoms of depression and thoughts of suicide. It is important that the person have someone who's there for them and checking on them on a regular basis. It is also important that they have an environment that is not too stimulating and is safe. A family member, in terms of supports when someone's going through detox, is to know what the red flags and the warning signs are. To make sure you have the phone number for the GP, that you know how to call an ambulance if you have to, that you have access to, if there's any therapist or support work or key work involved, that you have access to them and their phone numbers as well. And that you're checking on that person regularly, that you're reassuring them that this is a temporary process and it will improve. To understand the process, what they're going to be going through. And to make sure you're aware of what the signs and symptoms are physically, but also emotionally. So the physical withdrawal symptoms for an alcohol detox include, as I said, increased temperature with sweating, feeling of anxiety and shakiness inside, accompanied by tremors of the hands, nausea, diarrhea, insomnia, irritability, lack of appetite. But also, it's an emotional roller coaster. So they usually will experience depression, irritability, inability to tolerate what stresses, even things like loud noise. So helping that person would be giving them a safe, comfortable place, a quiet place, usually not too brightly lit, somewhere they can be calm and be settled, and with not too much stimulation during the first 3 to 4 days of the detox. Now, this is not always easy to accomplish in the homeless setting, but it's important for the staff involved, their support worker, key worker, whoever the person might be, to try and arrange that they have the best appropriate setting and that they're being checked on regularly. So, for example, you have someone who's sharing a room in a hostel. It would be nice if during the detox process they could be in a single room where it's less stimulating. The other concern in the homeless situation is that there are other people drinking and using around them who may not be supportive of them going through the detox process. So it's important that they be in the most supportive place they can. Emotionally, they'll need support because anyone going through the withdrawals, because of the chemical changes in the brain, will experience depression. But the other thing that can be going on too for these people who are going through withdrawals is they may have been medicating a depression with the alcohol. And once you take away the alcohol, that depression is still there and it bubbles back up again. So it's also supporting that person, making sure they're safe, making sure they're getting to talking to people, communicating, not isolating. If they have access to a therapist, that they're doing that. If they need to be reviewed because of thoughts of wanting to hurt themselves, then to be seen by the doctor and seen whether they need to be hospitalized if that's the case.